A red alert tonight about a life-threatening but hidden medical condition. Doctors report a disturbing increase in cases of aortic dissection. That's a defect in the main chest artery. It's often mistaken for a heart attack, leaving the real threat undiagnosed and patients at risk of death. CTV's medical specialist Avis Favreau now on the warning signs Canadians need to know.
There's a troubling rise in cases like Shelley Johnson, a 51-year-old nurse who, while at work, felt a sharp pain in her chest.
It just felt like an elephant was sitting on my chest, just like other people would describe a heart attack, and that's exactly what I thought I was having.
But the tests were all negative. Only a last-minute CT scan uncovered the real cause and saved her life. Shelley's aorta, the main blood vessel in the chest, had torn, called an aortic dissection.
We refer to them as the great masquerader, and that's because they can really present themselves as one of many other diagnoses.
Without fast diagnosis and surgery to repair the tear, dissections can kill.
The risk of dying per hour with a type A dissection is 1 to 2% per hour.
Doctors suspect that about 50% of patients with aortic dissections die before they even get to the hospital. And so they're trying to raise the profile of this rare but growing problem in a bid to save lives.
GADA, formerly known as CMA, was established 34 years ago with its primary vision being to bring awareness, education, support, and research to a rare aortic disorder called Marfan syndrome. In the early 2000s, innovations in digital genetic research resulted in the discovery of new mutations at such a rapid pace it was necessary to properly classify them in order to establish an appropriate treatment protocol for each disorder. CMA realized the need to widen its scope to include the genetic mutations that have very similar aortic and vascular features.
In Toronto, there was really a lack of a concentrated, focused place where patients could go and have a multidisciplinary approach to their aortic condition. GADA approached me because there was really quite an urgent need for patients to have access to a specialized aortic clinic.
GADA continues to drive the creation of multidisciplinary clinics across Canada as a primary focus, along with research promoted with the invaluable help of the Temerty Foundation. Although this research has broadened our understanding of the causes and features of genetic aortic disorders, it has not yet taught us how to treat them. In 2013, GADA made an unprecedented call for an international meeting of scientists and clinicians to freely discuss and compare patient data, treatment protocols, and their outcomes. This resulted in the formation of the Montalcino Aortic Consortium and the creation of an international registry.
50 sites worldwide participating in this consortium to identify cases of acute aortic dissections where we don't know the genetic risk, but also to define the disease associated with the genes that we have identified.
To date, there are 56 MAC member clinical centers that feed into 2 data collection portals in Houston and Paris. GADA's ultimate goal is to see an aortic research center established within Canada and an internationally recognized standard of treatment for all genetic aortic disorders. In order to realize our expanded agenda, GADA needs to update its strategic direction and align it with new resources.
We have a long list of research topics that we want to address, and we really need funding to be able to do that.
To date, we have funded research from all over the world, notably in Berlin, Yale, the Cleveland Clinic, Houston, University of British Columbia, McGill in Montreal, and UHN in Toronto. GADA will continue to fund the research generated by the MAC registry. GADA's model has now been adopted by the American Marfan Foundation. GADA is the first organization to include and support all genetic and aortic disorders. As a result of the Temerty Foundation's research fund and the findings generated by the MAC registry, GADA is recognized as far away as China, Australia, and Sweden, among many other countries. With your help and that of our professional advisory board, headed by Dr. Morel Uzunian, we are confident that we can succeed in our endeavors.